Good afternoon. Welcome to SUBASE New London's COVID-19 Vaccination Town Hall. I'm Captain Todd Moore, Commanding Officer of the base, and I want to extend a warm welcome to you today to learn more about the COVID-19 vaccine, the disease itself, the vaccine, and the Navy and our local efforts to combat it with the vaccine. So I'm joined today by Dr. Patrick Henderson, internal medicine doctor at our own clinic on base, who will help me to give you the very latest scientific education on what the vaccine is and to encourage your participation in the DoD's vaccination campaign. During this session, you will be, there is a Q&A chat available. We have a moderator who will be monitoring that and forwarding us questions from you, so please ask questions at any time. You'll find as we go throughout this presentation, we hope to be answering most of those questions with the brief itself, but we will pause at the end and make sure that we address your questions. In addition, subsequent information about today's session and future sessions will be posted on the SUBASE Facebook page. So keep your eye on that for follow-on information, including subsequent broadcast times. We plan another one of these sessions tomorrow at 10 and next week, including some evening time slots. So if you found this information useful, beneficial, please tell your friends about it and encourage their participation. So before we get into it, I want to thank you. Thank you for your participation today. You are an essential element of getting our vaccine distribution, making it widespread so that we can, with your help, move on to defeating COVID-19. So with that, we're going to shift over to a slideshow presentation. Dr. Henderson's going to lead off and walk us through that. So, Doctor, floor is yours.
Thank you, sir. Thanks for inviting me here to talk about this today. And I want to echo what Captain Moore said. Thank you for tuning in. I know there's maybe more exciting ways to spend your lunchtime than what we're about to talk about, but this is really important stuff. As Captain Moore said, I am an internal medicine doctor, and part of internal medicine is infectious disease. So I'm not an infectious disease specialist, but I do get a bunch of training in it and have taken care of many patients with COVID over the last year and many sick folks. So I'm here to explain the vaccine, sort of why it's a little bit different, a little bit about viruses, why the vaccine is safe and effective, and then some of the statistics in terms of what's going on currently with the state of the pandemic. So if we go on to the next slide, I think a great analogy for your immune system and what's going on in your body all the time is that you are constantly at war. It is weird to think about, but you're actually mostly bacteria. Like if you counted every single cell in your body, there's more bacterial cells than there are human cells. Bacteria are one of the many different microorganisms, small little critters that are constantly trying to get in and cause problems, but there are lots of bacteria that we get along with just fine. Viruses are a different category. Viruses are really simple. It is basically just a blob of genetic material wrapped up in a coat or an envelope on the outside. And so this version of the coronavirus has some unique characteristics that are why it causes so much trouble. And that is part of what we've targeted with this vaccine. So if you look at this slide, that top left figure there it's a cartoon. Of course, it's just a graphic representation of what the coronavirus is like. And you see those little red guys on the outside. Those are called spike proteins. Protein just means something that an organism makes. So coronavirus makes these spike proteins, but those spikes are one of the ways in which coronavirus gets access to your body, gets inside your cells and causes problems. So the spikes are important for the virus to cause disease in the first place. And then thankfully, with this technology that we have available to us now, we've been able to utilize those spikes to generate this vaccine that we have available to us. So on our next slide, we'll talk a little bit about the vaccine itself. You may have heard how this is a new vaccine, and I would better describe it as a newer vaccine. We've had technology to make vaccines in this method for a while. It's just that we've never had a crisis like this to really prompt us to generate this many doses of this kind of vaccine. This particular kind of vaccine has been used for other viruses and diseases that you may have heard of, such as Zika virus, which was an issue a few years ago, for rabies, which I think everybody's heard of, and for the kind of the first time we saw a virus like this, the original SARS outbreak from about a decade ago. So the idea with this vaccine you may have heard of in the news is that it is an mRNA vaccine. So what does that mean? RNA is a version of DNA that our cells use and that the virus uses to encode genetic material. And so mRNA is a particular kind, it's called messenger RNA. We figured out a way to use the virus against itself, essentially. So with this vaccine, the patients that receive it get injected with virus mRNA, a tiny little snippet of this particular genetic messenger system. That mRNA then is used by your immune system cells to get them to generate those M-spike proteins, and then your immune system now has access to these really specific targets that it can in turn use to make antibodies against the virus itself. So it's essentially turning your immune system into a factory that is training to know what to do if it ever sees coronavirus in the wild. This vaccine does not give you COVID. It does not get into your DNA. It gets into your cells and just trains them to work better, but then your body quickly disposes of it. So it is essentially a very fast training tool for your body to know what to do should it ever actually see coronavirus, and therefore hopefully keep you from getting very sick were you to get exposed to coronavirus. With the next slide, we'll talk a little bit more about vaccine development. So again, stuff that you hear in the news and maybe aren't too familiar with. When we talk about vaccines, I feel like it's a maybe counterintuitive framework to think of it, but vaccines are medicines. And so they go through the same kind of vetting process that a regular medication would go through, such as cholesterol medicine or antibiotics, stuff for blood pressure. So with all of our medication trials, we go through phase 1 first, which is volunteers. All this is volunteers, of course, but we pick a small group of volunteers to start with this vaccine. And in this particular vaccine trial for the Moderna vaccine, which is the one that we have available to us, there were 120 volunteers. And with these trials, we're looking for 2 important data points, which is 1, is it safe? And 2, is it effective? So those first 120 volunteers took part in this, received the vaccine, and were monitored very closely for any kind of side effects. And whether or not the side effects were major, we grade side effects in terms of the frequency, either greater than 10%, 1 to 10%, or less than 1%. And so those first 120 did really well. And so the vaccine trial then moved on to phase 2, which is basically just the same thing with a larger pool of volunteers. So now we're getting more people. And potentially, as we test more people, we are looking for the same kind of issues in terms of safety, and then also checking to see if it's actually working. So whether or not the patients have an immune system response to the vaccine. Phase 2 went well, and so we moved on to phase 3, which is significantly larger, as you can see there. So 120 people with that first round, 600 with the second, and then over 30,000 people volunteered for phase 3. Which again, continue to monitor these same endpoints, which is how well does this work, how safe is this, and then comparing it to a placebo. So in vaccine trials, we do what's called a double-blinded trial, where the people that are giving the vaccine, so the study administrators, the doctors and nurses that are actually running the show, and the patients themselves do not know what they're getting. They could be getting a saltwater injection, or they could be getting the vaccine. So that's what a placebo is the saltwater injection. And we check and see if people are having side effects or immune response, and if there's any difference between the patients that received the saltwater injection or the ones that received the vaccine. Phase 3 went so well that the FDA, the Food and Drug Administration, which is the government organization that monitors all this stuff, granted an EUA, an emergency use authorization. Because what we saw with phase 3 of the Moderna and the Pfizer vaccines as well, is that this is both safe, again, the number one thing that we want to see, and then effective, and we'll talk about efficacy here in the next slide. And then also that the benefits outweigh the risks. This is a crisis that we are dealing with right now. We'll talk more about Los Angeles later, but The benefits of this vaccine are massive, and the risks of this pandemic continuing to rage in the way in which it has are massive as well. So this is safe and it's effective, and the good is outweighing the bad. So we were granted emergency use authorization. We'll go on to the next slide and talk about vaccine safety. So side effects, you might have heard about these. I got my vaccine 3 weeks ago, and I literally thought the corpsman missed when he was giving me the shot. I could not feel the needle going into my arm. I went to bed maybe a little bit earlier than I normally would the night of the vaccine, and then woke up the next day and my arm hurt. It hurt for about 3 days afterwards, not to where I couldn't work, certainly, and it actually felt better if I did push-ups. So as you see on this slide, these are the common vaccine reactions to this particular vaccine, the Moderna vaccine. Like I said before, when we talk about side effects and reactions, we break them down into 3 broad categories, either greater than 10%, between 1 and 10%, or less than 1%. So these are the common ones. This is 10% or more. So pain at the injection site. I didn't have that the day of, but my arm was a little tender over the spot the next day. Fatigue, I would say I felt that myself that night. Headaches, relatively common at 60%, along with muscle pains and joint pains. Nausea, vomiting, thankfully relatively rare. About a quarter of people have reported that. Axillary swelling and tenderness. So axilla is the medical term for your armpit, and there's actually a lymph node inside your armpit. So whenever you have any sort of inflammation in your arm or your chest, you can get swelling in your armpit from the lymph node getting activated. That's about 20% of people. Fevers are relatively rare. I would say, unlike the regular flu shot, which is fever is a very common side effect with that, but some of our patients have had fevers after getting the vaccine, usually in the subsequent days. Swelling at the injection site or redness at the injection site as well, along with that tenderness. So those are the more common ones. On our next slide, we'll talk about less common. So meaning the greater than 10% reactions, I feel like all those are intuitive and can be reliably associated with the vaccine itself. With rare reactions, meaning less than 1%, we never really know if it was the vaccine that caused rare reactions or if it was just something that was going to happen with that patient anyway. But because we watch these trials so carefully, literally anything that happens after you receive a vaccine, we write it down and just track it to see if there's any sort of trend. So allergic reactions, meaning massive swelling in like your tongue and your lips and your airway, those are extremely rare, exceedingly rare. And they happen in the kinds of patients that have had allergic reactions, again, serious allergic reactions where they have compromise in their airway with other vaccines. So in the several hundred doses that have been given in my clinic, we have not seen any serious allergic reactions, even in a lot of patients that have had allergies to other things like pollens and dust mites and cats, stuff like that. Other adverse reactions, again, extremely small numbers. Of course, these are the exciting ones that make it into the news, but on the grand scale, they are super rare, and there's still no way that we can directly link unusual bad reactions with the vaccine. With autoimmune disorders, there is not a whole lot of safety data on that so far because, again, that trial had 30,000 people in it. But as more of our countrymen have received this vaccine now, there are lots of data showing that there's a benefit to patients with autoimmune disorders receiving the vaccine, things like lupus and rheumatoid arthritis. The official statement from the American College of Rheumatology is that if the benefits outweigh the risks, then patients with autoimmune disorders should be receiving the vaccine, but that's an individual discussion people should be having with their physicians. With weakened immune systems, which in a sense, that is a manifestation of an autoimmune disorder, there's debate again over that and still limited data, but these are, if you have a condition where your immune system is considered to be weak, and this is the kind of thing that you need to be bringing up with your doctor because in many cases it will make sense for those patients to receive the vaccine. Pregnant or lactating patients and young children, unfortunately, are 3 populations of patients. And when I say lactating, I mean, I think that would maybe be better described as breastfeeding. 3 different classes of patients that it's notoriously difficult to get any volunteers to perform clinical studies on, and I feel like that's very understandable. So thus far, the data is limited on pregnant patients and breastfeeding patients, but everything that we've seen so far has shown safety. And again, that is a discussion that you should be having with your obstetrician or pediatrician for those of you that are breastfeeding. We'll move on to the next slide. All right, so we talked about safety. The vaccine is safe. Bad side effects, super rare. The common side effects are common and they are a little bit obnoxious, but that is it, a little bit obnoxious. This is the does it work slide. So if you look at these two lines, I know this is maybe kind of tough to see depending on your screen size, but placebo versus vaccine, and what those lines are tracking, the red line, the vaccine line, is the percentage of people that actually were positive for COVID, that actually acquired COVID after receiving the vaccine. Day 0 there is the day they got the shot. So the blue line, as you see the placebo, the folks that got saltwater injections, that is going up, up, up over time, meaning the people that got the saltwater injections were getting COVID. The red line, the vaccine line, is not 0. There were some people in the study that still managed to contract COVID, 11 of them altogether in this particular phase of the trial. But compared to the 185 people that got the placebo that contracted COVID, that is a significantly advantageous response in terms of what this vaccine can do for you. So the vaccine is safe and the vaccine is effective. Therefore, it was granted emergency use authorization by the Food and Drug Administration. And on to Captain Moore.
Okay, so we've seen why the vaccine was developed, how it is generally safe and very effective. Now I want to talk about why it's important that as many people as possible receive this vaccine and how the Department of Defense and local efforts will bring it to you. So you see in front of you here, this slide depicts the state of the pandemic in both Connecticut and the local New London area. This data is as of mid last week. However, we will provide updates in tomorrow's broadcast if you want to stay up to date with us. Nonetheless, it shows a rising and very disturbing case rate. The upper two graphs are the number of infections per 100,000 people in the last 7 days. And you can see that they've been rising nearly steadily since October. In the very bottom of those graphs, you'll see a green and yellow band. That infection rate represents the local infection rate we need to get back down to in order just to enter health protection condition Bravo or Alpha. So you can see the big task we have in front of us. Right now, we're running around numbers of 700 infections per 100,000 people in the past 7 days, and we need to get back to numbers less than 50, less than 25, 0 ideally. So big work to get done. In the lower two graphs, you can see the cases per reported test, or the positivity rate. This shows of all COVID tests administered and analyzed, the percentage of those which are positive. The rising trend, again since mid-October, shows you that the number of increased cases is not due to increased testing, but actually due to a greater prevalence of COVID-19 in our area. And I'm certain you are just as well aware of that as I am. In addition, if we were to look for even more concrete data, next slide please, you'll see the graph of death rate in Connecticut. So a large spike in April-May timeframe when the virus first wave came through Connecticut. And then again, you can see a steady increase since October-November timeframe and continuing to grow. These are people dying in our communities. These are members of our families, our extended families and coworkers who are suffering from this disease. As of today, 97 people in New London County hospitalized due to COVID-19. So what can we do about it? Well, now I want to talk to you about the DoD's rollout campaign. Next slide, please. We'll show you that as we begin to vaccinate people, our health protection measures will remain in place because we need to make sure that we continue to tamp down. These health protection measures are effective. We know that, for example, the rates of flu transmission have dramatically declined in the state and in the nation because of our health protection measures. But they themselves are not enough to stop the COVID-19, which is why we're going to have this two-pronged attack: vaccination and continued health protection measures. And those will remain in place until the infection rates go down. that red graph I showed you. When that gets back down, then we can relax our health protection measures. And of course, for military members who have signed page 13s indicating what their health protection restrictions are, those remain in place even if you're vaccinated. They remain in place until enough of us have been vaccinated that we can knock down the infection rate. Next slide, please. So how many people do need to get vaccinated? Well, numbers vary. We've seen in reports anywhere between 60 and 90% of people need to get vaccinated in a given population to achieve herd immunity. Submarine Force Atlantic recently put out a number of 75%. So numbers may vary, but it's in the range of 60 to 90% of personnel. The number, this is of last week, most up-to-date numbers are now over 10 million, but over 10 million personnel on the right, down in the yellow, you see 10 million people have been vaccinated. We need to get up, as a nation, we need to get up into the hundreds of millions, as no doubt you are aware. Now, while I'm on this slide, I just want to note to you that several people have indicated a reluctance to become vaccinated because they want to see more people get vaccinated to make sure it's safe or okay. Well, 10 million already have. So not only did the studies show great safety data, but 10 million of your fellow citizens have already rolled up their sleeves and gotten the vaccine. So there's no need to wait when your turn comes. And I'll tell you about when your turn might come in the next couple slides. Next, please. All right. So there is a Centers for Disease Control and Prevention phase, and then a DoD phase. And I want to talk to you about the DoD phases for a moment. So phase 1A is to cover all those healthcare workers and emergency response personnel that we need to keep our population healthy and cared for. That phase is nearly complete here at the submarine base. We received an initial batch of the Moderna vaccine and have administered it to nearly all of our medical providers, base fire department, which provides emergency management response, and our base security forces. The next phase that will apply here at SUBASE New London is this phase 1 Bravo 2, those preparing to deploy overseas. So I've given some examples to you in the right-hand column. That will include most of our submarine waterfront, as well as those who support them. Submarine squadron staff, maintenance staff, inspection teams, training personnel who make deployments possible. You see under that, phase 1B3 for those authorized personnel over 75, and then 1B4 will be other critical and essential support personnel that provide support functions around the base, from port operations, galley food service, commissary employees may be in this, child development center employees who are looking after our children, and so forth. Continuing on to phase 1C, we expand eligibility to those 65 to 74, and then those personnel with additional risk. So no doubt you may be asking, well, when will my group be able to receive the vaccine? As I've indicated, the first phase is complete, and we are receiving periodically additional batches of vaccine. When the vaccine is received, the clinic is organizing the effort to notify commands and personnel who are eligible for the vaccine to come and sign up for a vaccination time slot. Last week, we converted Morton Hall Gymnasium into a vaccination site, and we're able to get through hundreds of personnel a day at that facility. And we look forward to doing that again in the future. So when your command or your activity or you as an individual are called to participate, it may be that you go to the Morton Hall Gymnasium or perhaps the clinic to receive your vaccination. All right, so that is the plan. I can't predict when a particular subgroup is going to receive the vaccine, because as you know, supplies are limited. And so we're just keeping our eyes open, and we will notify personnel when their window comes open. All right, so now if we could cut to the live video, I want to talk for a moment about why we get vaccinated. So COVID-19 has certainly affected us all. It has hit the SUBASE community. It has impacted our operations. Some of us have lost family members, and it has certainly impacted our entire way of life. Certainly, even to do a broadcast like this is new in these COVID times, right? It's impacted our local business community. It's impacted the way our ability to move around the country. It's impacted our ability to take vacation. It's impacted the fact that we have to wear these masks all the time when we're near other people. None of this none of these are changes that we want. Instead, we want to get back to what I'd say a new and better normal, right? A new and better normal where we have learned the lessons of COVID-19, but we don't necessarily need to wear these masks all the time, and we can get back to meeting in person. That's the goal, and there's only one way to get there. COVID-19 is not going away. COVID-19 will only go away if we fight it with a vaccine, right? And that's why we need you to roll up your sleeve to get vaccinated. And if I may cut back to the slideshow here, and I'll ask the doc to chime in here in a moment, but this is a recent slide of the number of deaths in Los Angeles County. If you've been tracking the news, you know that they're just overwhelmed with COVID-19 there, and these are hundreds and hundreds of people dying every day in just one county alone. And granted, it's across the country, but being a diverse community, there are no doubt many of those listening have family members in that area or have been PCS'd to that area before, lived there before, and COVID-19 knows no borders, right? So infection rates climbing elsewhere mean that infection rates and unfortunately death rates here will rise in the future. So we need to get vaccinated, folks. And Doc, anything else to amplify on this?
Yes, sir. Thanks. I would dovetail on all of that. It's been a tough year, to put it mildly, and we're all tired of this too. Especially us up in medicine, we've all dealt with our own personal issues with COVID and how stressful and how much this has changed our lives. We're doing half of our clinic virtually. I miss you guys. I like seeing patients in person and wish we could have more people coming in, but at this point it's just not safe. I know that we are uniquely sort of weirdly protected here in Connecticut because Connecticut, and the SUBASE in particular, has done a great job as best we can with managing this disease. But as Captain showed us that slide from LA County, this is a catastrophe, and it's tough because it's the continent away and you can't take news cameras inside intensive care units. But if you could, and if you had any sort of familiarity with working in intensive care units, it can't be stressed enough what a catastrophe this is, how seriously terrible this has been for our second largest city in this country. They've got 2 patients per room in intensive care units. They're rationing oxygen, which they've never done before. If you get super sick at home and lose your pulse and your family can't do CPR to the point where they can bring you back to life, they're actually not sending ambulances to houses in Los Angeles County anymore. They're telling you to call a morgue. They literally this weekend, and this is if you take nothing away from this other than what I'm about to say, this is a truly grim fact. They changed the rules this week on how many bodies can be put in a crematorium at the same time because they have such a backlog. This is catastrophic. We don't see it here because, again, we're protected. We have a relatively young and healthy population. But I personally, over the last 3 weeks, have lost 3 close family friends to COVID. I've had multiple patients die from COVID. I've had multiple folks in their 20s and 30s spend weeks in the hospital, some in the intensive care unit, that are still recovering now months later. I myself, I 15 years in the Navy, never missed a day of work for being sick. I was out for a whole week with it back in the spring, and I still don't really feel totally normal yet. So it's a crisis. And I know you hear this all the time on the news. And again, I thank you for tuning in and listening to us over your lunch hour, because this stuff is really important. And the only way out of this is with the vaccine and continuing to go with the masks and the hand washing and the social distancing. It's the only way we're going to get back to normal life. The vaccine is safe, it's effective. Your arm hurts for a few days. It kind of seems like a no-brainer. And it's the way to get back to normal life. So thanks, Captain. I appreciate it.
All right. Well, I'm sorry to hear about your losses there,
Thanks,
Doc.
sir.
But thank you for sharing that powerful story. And with that, I'm going to shift over to questions from our audience, and I'll be reading from the questions that you submitted here over the computer. So, and no doubt many of these will go to Doc Henderson here, and I'll start off with one that says, how long after having COVID can I get the vaccine, or do I need the vaccine?
Excellent questions. So when you get sick with something, depending on what you get sick with, a lot of times you'll start to make your own antibodies, and we have seen that for a lot of people with COVID that get tested for antibodies afterwards. They do frequently will make antibodies for a period of time, but it's not universal. So just getting a COVID infection does not guarantee that you are going to have long-term immunity from getting reinfected. It is possible. So that would be number one, I guess, is that I haven't had COVID. We do still recommend that you get the vaccine. It is still safe. It is still effective. And then the timing, that's another great question. So the general go by with this, because people that have been infected with COVID have not been part of a large study yet, but what we've seen in practice with these 10 million people that have received the vaccine is that generally we want people to wait until they are feeling better enough from their COVID infection that they're not continuing to need medicines like Tylenol or ibuprofen to deal with the aches and pains that frequently come along with COVID. So basically, once you're feeling back to normal and you're not needing to take any over-the-counter medicines, you're good to go on getting the vaccine.
Okay. All right. Thank you. All right. Next question. When it's time for the second dose, will we receive that separate dose from those? We'll receive that separate from those receiving the first dose. So can you tell us a little bit about how the second dose rollout may be, and about will it be the same type of vaccine as the first dose?
Yes, sir. So good question. With our vaccine, we're using Moderna, as we talked about earlier in the presentation, and I'm sure you've heard about in the news. There's 2 different vaccines currently available. A couple more in the mail. It looks like over the next few weeks we'll be hearing about different ones. But for what we've got now, which again, safe and effective, the one we have here on base is a 28-day interval in between your first and your second doses. So I guess reading that question, when it's time for the second dose, will we receive that separate from those receiving the first dose? Maybe we're not totally clear on that. The folks that are receiving the first dose will be still receiving it from our immunization staff, but would be in a cohort of other people that are receiving their first dose at that same time. I hope that's clear. If you want to write in a clarification on that, I'd be happy to answer it.
Okay. All right. Thank you. Let's see. I'll field this one here. Are contractors part of phase 1 Bravo 2 if we support submarine maintenance? And the answer is probably, but it may depend. So in general, the DoD has authorized the vaccination of contractors, provided they're eligible and fall into one of the phases I've described. The specific rules are for that were laid out in a Deputy Secretary of Defense memorandum, and in a particular case of a contractor, if you're directly supporting submarine maintenance, my guess is yes. However, what you ought to do is contact your command to be sure that your particular billet falls within the phase 1 Bravo 2 that you mentioned in your question. Okay, let's see here. All right, Doc, here's a question about Tricare. So will Tricare cover the cost of receiving the vaccine out in town for active duty and dependents like the flu shot?
Good question. So for those of you not familiar, haven't heard that phrase before, Tricare, that's our health insurance. So usually it's kind of a weird thought, you just come and see me, you don't have to pay anything, but there is an organization that helps with managing all this. So going out in town to get the flu shot, I actually did this myself last year because it was taking a while to get the flu shot here, and I just showed them my military ID card at the Big Y, and they gave me my flu shot, and then sent the bill here and the paperwork to the clinic. As of now, that is going to be the plan with Tricare. That's what's officially published on their website, is they're going to be deploying a similar sort of technique with getting it out in town. If once it becomes widely available, you decide you want to do that, then it will be covered with Tricare. What I would say, and I don't know because this is, again, such a different world compared to everything that's happened before now in terms of medication, is that previously CVS pharmacies, and CVS pharmacies are located within Target stores, have not taken Tricare for things like prescriptions over the last couple of years that I've been here. They have been providing flu shots for active duty folks and dependents, and so I'm not certain if they're going to be taking a similar approach with the COVID vaccine, but literally everywhere else but CVS, meaning Walgreens, Stop and Shop, Big Y, any sort of civilian pharmacy or places that offer vaccines do take Tricare, and it is very straightforward and streamlined. You just show them your dependent or active duty ID card. They send us the info.
Okay. All right. Thank you. All right. Let's see here. Another question here about vaccine timing. So a viewer questions, with the first vaccine received on the 15th and the next one due on February 12th, will there be another mass vaccination site set up for that day? So I'll take that. To answer your question about whether there will be a mass vaccination on that particular day, I can't necessarily answer that, but I can say that we are seeking to, first of all, get large numbers of vaccines to the base. The clinic has taken a census of our area, and given the total breadth of active duty dependents, contractors, civilian employees, retirees, that about 17,000 doses would be the need here. And so we've submitted that data. We're getting periodically batches of several hundreds. And so as those come in, we're administering them as quickly as possible. That's the goal, is maximize immunization rate. To do that, we're setting up in the gym those mass vaccination sites. So it may depend on timing as to whether that particular day there'll be a site at the gym, but we'll be putting out that information. We'll be sharing it on the SUBASE Facebook page. But I guess we'll have a follow-up question about this to the doc then. I guess what's the best way if someone has a particular question saying that, hey, I need to get vaccinated on this particular day, should they be calling the clinic to make an appointment?
So we have actually a whole section that we've broken off from our main clinics, or our COVID task force, that is specializing in fielding COVID-related questions and then coordinating with the immunizations clinic as well too. Our corpsmen are folks that administer vaccines, not just regular corpsmen. They actually get a massive amount of extra training on vaccines in general, and then specifically this COVID vaccine has required extra training in addition to that. So there are subject matter experts, and in terms of being able to book, if you've got a particular tight timeline between calling the clinic and maybe not needing an in-person appointment, but just coordinating with our entire COVID team, that would be the way to do it.
Okay. All right, fantastic. All right, next question here. Are the second dose side effects the same?
You may have heard that one, yes. So I went to the University of Iowa for medical school, and I have a lot of friends that are living all over the country. Actually, one of my best friends is an intensive care unit doctor in Los Angeles. So again, I've got a lot of folks all over the place that have told me how bad this is where they're living. Many of my friends that work in emergency departments and intensive care units got the vaccine the first day it was available, so they've actually had their second dose, particularly with the other one that's available currently, the Pfizer vaccine. It's 3 weeks later. And I have heard from many of my friends that the second one does make your arm sting a little bit more. It's the same list of potential side effects, but apparently it's not uncommon that people feel a little more fatigue and maybe a little more arm stiffness and soreness with the second dose, but same duration of symptoms, feeling tired that night, just maybe more profound. Certainly far from universal, but and doctors are kind of notoriously for whining about things, so maybe it's just my buddies, but same list of side effects with the same one.
Okay, and again, that first page of common side effects you mentioned are really a sign that your body's responding to the vaccine. Right?
Exactly. That's a great way to put it. When we feel sick, it's your immune system that is actually making you feel sick and not the infection. So we are basically giving your immune system a crash course in what to do when it sees COVID. And so it can make you feel a little cruddy. The aches and pains and fevers and sore muscles, that's all immune system getting fired up. So it shows that things are working in a sense.
Okay. All right, great. Let's see here. Okay, question is, as we are approaching the PCS, permanent change of station season, will dependents who are going overseas be eligible for the vaccine, even if it is outside their vaccination stage, to ensure that both vaccine doses are received before travel and that the same vaccine is administered? So I'll take a crack at this, and maybe Doc can provide some follow-up. But current DoD guidance is that if you are approaching a PCS move, that you wait to get the vaccine until you reach your ultimate duty station. To address that very concern that you mentioned, you want to ensure that you have received both the first and second doses from the same manufacturer. And we can't necessarily predict that manufacturer's vaccine will be ready for you at your destination when you show up. So for those who are PCSing in the near future, for the next 1 or 2 months, is advised that you wait until you get to your ultimate duty station. Now, as the summertime approaches and more vaccine is available in the local area, that guidance may change to say get both doses now before you go. But it really depends on your timing. And Doc, anything to add to that?
No, I would just echo all that same sentiments. All right, there's certainly not been any studies showing, what happens if you get one version of the vaccine and then follow up with the second one. Intuitively, it seems like it would be okay, but we don't know. And so to ensure the appropriate vaccine is given at the appropriate time, it would make more sense to wait until after PCS as it stands currently.
Okay. All right. Okay. There's a question here about if you've recently received a biological injection, should you get the vaccine?
I assume that it's going to be a specific question related to different kinds of medications. There's a few things, you see them advertised on television, maybe. There's one called Humira, Enbrel, Stelara. Basically any kind of medication that's given as an injection, and some of our patients do these themselves at home, or some come to the clinic to have nurses give injections, are altering the immune system. We use this class of medicines for a bunch of different diseases. We laugh, they're kind of like medical duct tape, like you can use them for practically anything anymore. But they do, in a sense, alter your immune system, intentionally hobble it or dampen it in a sense for people that have diseases in this broad umbrella of diseases. And so that is a discussion that needs to be had specifically with the doctor that is prescribing that medication as to whether or not it's the right thing to do. One of my good friends from medical school is a rheumatologist, which is a subspecialist that focuses on this whole category of diseases, and most of his patients are on injected biologic medications. And again, the official policy statement from the American College of Rheumatology thus far is that for the vast majority of those patients that are stable on their diseases, or on their medications rather, and their diseases are stable, that they do benefit from the medication. If you're one of mine, I guess you probably are. If you're seen at the clinic, then please, I'm always there. Come by and ask, and we'll talk about it and go over the pros and the cons. But the usual answer to that one is yes.
Okay. All right. Thank you. Another common question that we get is that if I get the vaccine, will I test positive for COVID-19 after I get the vaccine? What happens?
That's a good question, because there's a few different kinds of tests that you could get for COVID, essentially. We don't do the antibody tests here. The tests to make sure that patients were responding to the vaccine appropriately were run by Pfizer and Moderna, the companies that are doing these vaccine studies. So when we're talking, that test, if we did them, theoretically, yes, you would turn positive for and show that you are, protected from COVID. Mm-hmm. The one that I feel like a lot of us are familiar with now, which is the obnoxious nasal swab, where it feels like they're trying to get to the back of your brain through your nose, that will not turn positive as a result of getting the COVID vaccine. That's a sign of active infection. That's a virus replicating in the back of your nose. And if you get the vaccine, that's not what it's causing to happen.
Okay. All right, thanks. And another common question is about children and whether children can receive the COVID-19 vaccine.
Good question. So as I said before, there's a kind of three categories of patients that drug companies are sort of notoriously gun shy about doing studies on. It's tough to get volunteers for children and breastfeeding moms and pregnant women. And so the Pfizer vaccine was tested all the way down to age 16 and up, and the Moderna for age 18 and up. They are working on gathering data on kids, people that are willing to take part in these studies, but since we don't have any reliable data on it yet, it is still a recommendation that we adhere to those age-appropriate guidelines.
Okay, all right. Let's see here. So I know in the news recently we've heard mention of the COVID variants that are out there, a different form of COVID-19. So can you talk to us a little bit about the responsiveness of this vaccine in light of those new variations? And then as a follow-on, a viewer asks, when we get through this mess, will the vaccine be needed annually in addition to the flu shot?
Sure. So for the first one, that new variation of it, they sort of early on in the stages of the disease, back when it seemed like it was still mostly in Wuhan in China, we did know that there were two variants of it. We've seen a different approach, or not approach, but a different manifestation of this, more in the UK than anywhere else. And the good news is that in the UK, they've had a vaccine now for about the same time we have, and the vaccine seems like it is effective for this other variant of the virus. So you're protected against everything that we know about thus far with our versions of the vaccine that we have available currently. So that second question, once we get done with this mess, and yeah, agree with that, will the vaccine be needed annually in addition to the flu shot? I wish I could give you a good answer on that. It is, since it's so early on, we don't know. The hope is that because this does such an effective job at training your immune system to crank out the appropriate kind of antibodies and keep you from getting COVID, as we see more people getting vaccinated and these COVID numbers dropping, that it's not going to need to be an annual thing. It's a different kind of vaccine, so that hopefully it affords you some long-lasting immunity. But we'll have to see. The first day of medical school, they tell you half of this is going to be wrong in 10 years. So I don't know what's going to happen a year from now, but the hope is that it doesn't need to be an annual thing.
Okay, thank you, Doctor. Okay. All right, so I think we've hit the bulk, if not every one of the questions out there. Of course, if you have anything, don't be afraid to continue to chime in. Our moderator will remain active online here for a few more moments as we conclude this. But I just want to conclude by thanking Dr. Henderson for joining us. As he mentioned, he's always there at the clinic, except when he's here with us.
Yes, sir.
But he's an extremely busy man, and for him to take time out of his day to come here and help us all get smarter, I really want to thank him for that.
My pleasure.
So, I also want to thank the great staff that helped put together this broadcast. It's not easy to throw something like this together, so thanks to the SUBASE Public Affairs and N6 team for their support. And in closing, I just want to say that we've learned that the vaccine is very effective and it's very safe. It may cause some minor discomfort, as I myself felt when I got the first dose last week, but it went away in a few days. And I think that's a very small price to pay for to avoid the risk of COVID-19. or to avoid the risk of myself infecting someone else, a family member or friend, and having them have an even worse reaction to COVID. That would make me feel even worse. So on behalf of those shipmates, friends, and families, please roll up your sleeve and get vaccinated. We as members of a wide defense community, I know I'm speaking to many people out there who are maybe active duty civilians, contractors, and family members. We at some point we signed on to this life of defending our nation, right? We either took an oath, in some respects, took an oath to support and defend the Constitution and to really protect America. And that's what this vaccination is about. Let's get back on our feet. Let's get the infection rates knocked down. Let's reopen small businesses in our communities. Let's get back to the gym, right? Wouldn't that be great? Well, to do that, it requires that you get vaccinated. So please do. If you have any subsequent questions, please roll on to our next slide here with the SUBASE Facebook page. You know where to go, right? Go there to learn more about what's going on in your community and at the Navy base as we fight against COVID-19. As I said earlier, there will be subsequent episodes of this broadcast put out for you. Next week, we're planning to do one in the evening, so please keep your eye out and stay posted. Back to live, please. So in conclusion, thank you for your participation. Thank you for your questions, and please get out there, get vaccinated, and stay healthy. Thank you.